Hello and greetings. It's a pleasure to be talking to you today for the second day of the Sustaining Behavior Change Conference. My name is Martin Hagger. I'm a professor of health psychology here at the University of California in Merced, and I'm also professor of behavior change at the University of Jyväskylä in Finland. I'd like to extend my gratitude to the organizing committee, particularly Kevin Masters and Christy Truesdale, for their organization and their kind invitation. I'd also like to acknowledge the contribution of the Anschutz Health and Wellness Center and the Nutrition and Obesity Centers of Colorado and the University of Alabama. I've entitled my presentation, Psychological Determinants of Behavior Change. Let's begin. Much of my career has focused on identifying the kinds of psychological factors that are reliably related to people's health behavior. What do I mean by health behavior? Well, these are the kinds of behaviors that people might engage or participate in, for example, to minimize their risk of chronic illness or to manage a current illness. For example, these might entail behaviors such as participation in regular physical activity, eating a healthy diet, not smoking, and drinking alcohol only in moderation. But they also might involve behaviors in clinical contexts, such as medication adherence or attending a screening appointment. This slide summarizes some of the kinds of research that we've conducted. I've used a box and arrow diagram. Psychologists are very fond of these box and arrow diagrams in order to illustrate the results of their studies. This particular study was a meta-analysis of studies looking at theory-based psychological constructs that are associated with health-related behaviors broadly defined. Many of the factors, constructs from these theories focus on people's beliefs. In this case, we can see that people's attitudes or their beliefs that the behavior will result in desirable outcomes, their subjective norms, so their beliefs that significant others will either want them to do the behavior or support them in doing so, and their beliefs about their control over the behavior. That is, their beliefs that they are confident or can perform the behavior in future. And these are related to people's motivation or intentions to perform behavior in future, and this is in turn associated with people's subsequent participation in those health behaviors. What is the value of these kinds of data or findings? Well, they might identify or signal the kinds of factors that might be targeted in behavior change interventions. If we assume that these beliefs can be changed, manipulated, using certain strategies or methods, techniques of behavior change that are used in interventions, then we may have found or identified methods that might reliably be associated or lead to actual behavior change. Now, the kinds of data that I just presented to you are correlational in nature. They don't necessarily tell me that changing people's beliefs, for example, will ultimately lead to changes in behavior. However, experimental evidence has suggested that those kinds of associations exist. This slide summarizes a meta-analysis, again with the box and arrow diagram, of studies looking at methods, strategies, or techniques aimed at changing those factors that I just introduced to you, those psychological variables. The results of the meta-analysis, this is a quantitative summary of the findings of this research, demonstrates that people's attitudes, subjective norms, and self-efficacy are changed by these kinds of methods, targeting change in those factors, and ultimately lead to changes in people's intentions or motivation and in their health-related behavior. So this broadens or moves the data further forward, identifying or suggesting that changing these factors actually results in a change in behavior. And that gives us good data on which we might base behavioral interventions in future. Now, the identification of these theory-based determinants of behavior change form the initial step in developing a science of behavior change. This is a relatively new discipline which applies scientific principles to understand, predict, and change people's behavior. It can be summarized in identifying what works in terms of changing behavior and how that works in changing behavior, and aims to develop optimally effective interventions or means to change behavior. Like I said, those theory-based determinants form the first step, but there are many other steps that scientists have started to perform in order to try to understand how behavior change interventions work and how we can most optimally use these kinds of methods and strategies to change behavior. And there are a number of steps and leaps forward that scientists have performed recently in contributing to this end. For example, identifying the kinds of techniques, strategies, or methods used in changing behavior. What methods have been used in the past? Have they been effective? And so on. This has resulted in classification means, so naming and coming up with a nomenclature for the different strategies or techniques that have been used and classifying them in taxonomies. Identifying the association between those methods or techniques and those theoretical constructs that I introduced to you earlier. In ontologies, networks of associations between these methods, the psychological factors they are presumed to change, and actual change in behavior. And then specifying exactly how those techniques or methods change those factors, activate those psychological factors, and lead to actual behavior change. And importantly, developing a basis or large body of evidence that demonstrates their efficacy in changing behavior is an important step. And therefore, producing a comprehensive evidence base for their efficacy, which can then be tapped into by people who are interested in changing behavior and developing behavior interventions. And then finally, of course, including those techniques and strategies that have been found to be efficacious in large-scale effectiveness trials in real-world field contexts. I will now outline some of those advances or steps and how they've contributed to developing optimally effective behavior change interventions. A key advance in the science of behavior change, as I intimated earlier, is the identification, classification, and naming of behavior change techniques. What are behavior change techniques? Well, they are the content of behavior change interventions. They are the methods and strategies that do the work when it comes to changing the behavior, often called the active ingredients of behavior change interventions. Now, classifications of behavior change techniques have attempted to identify the unique building blocks of those interventions, the irreducible and unique behavior change techniques. These can be seen as the tools in a behavior changer's toolbox, and they can be used independently or in conjunction with others in behavior change interventions. Now, these kinds of techniques we would expect to be associated with those kinds of factors that I identified earlier that are known as the determinants of behavior change interventions. So let's look at some work that has attempted to look at the links between techniques and those constructs. Now, developing an evidence base linking behavior change techniques from these classifications or taxonomies with the theory-based psychological constructs that are reliably associated with behavior, such as those as I presented earlier, is an important advance in the science of behavior change. Now, developing these classifications or taxonomies of behavior change techniques and coming up with a common language or vernacular to describe them is an important first step. But these taxonomies will have greater utility if the techniques that they identify and classify are linked with theory-based psychological determinants of behavior. So how do we identify techniques that reliably change these determinants and behavior? Numerous means have been purported to do so. One is just by knowledge of the theory, which demonstrate or theoretically identify the kinds of methods that might be used to change determinants and in turn change behavior. The other is through evidence reviews, looking at research that has looked at both changing methods that change behavior, but also concomitantly change the determinants of behavior. The third method is through expert consensus. That is, capitalizing on the knowledge of experts to identify these links. Now, this research has led to the development of so-called heat maps, which represent the strength of the evidence linking techniques with these constructs from different theories. And those heat maps provide us with an idea of where the current evidence lies in terms of the techniques that might be used to effectively change behavior and how they might be changing behavior by changing these theoretical constructs, and also where there is a dearth of evidence, limited evidence, linking techniques and these constructs and in turn changing behavior. In addition to that, it may also indicate which techniques are not effective in changing specific constructs and therefore changing behavior. Now, currently, those heat maps suggest that there is evidence for these links, but it's relatively limited, and particularly in intervention and experimental tests of these processes or mechanisms that may underpin behavior change as represented by the links between techniques, constructs from theory, and behavior. But this has led to a better understanding of the associations between these links and enables researchers to map out which techniques are associated with both behavior and the theoretical constructs they are purported to change, to provide a better picture and understanding of how these associations work. I've called this the mapping of the genome of behavior change interventions. Here's an illustration of that heat map of links between behavior change techniques and the psychological determinants they are purported to change. You can see in the grid that the blue squares illustrate support through evidence for those links. The blue squares represent non-links, and the white squares represent no evidence, with yellow representing inconclusive evidence. So you can see at a glance whether a particular technique is effective in changing a particular determinant, and it gives a researcher an idea of how interventions might work, purportedly using these kinds of techniques and strategies in interventions. In this slide, I present a further illustration of the associations or links between these behavior change techniques and these theoretical determinants which are purported to be activated in order to change behavior. At the apex, we have intervention content, and below that, we have a list of different behavior change strategies or techniques illustrated by the boxes, and the associated targeted determinants. For example, if we wanted to change people's beliefs, their attitudes towards a behavior, for example, their perceptions that performing the behavior will result in some desirable outcome, then we might provide them with general information about the positive outcomes, or describe the consequences of performing the behavior. If we wanted to highlight the risk of doing or not doing a particular behavior, we might emphasize a person's susceptibility of some illness or consequence of doing or not doing that behavior. If we wanted to promote people's support, social support from significant others, we might highlight that others may approve of changing their behavior. And we would do this through persuasive communications. If we wanted to change people's confidence or self-efficacy, we might prompt successful experience or mental rehearsal, help them to set graded goals, all of which might feed in to their sources of self-efficacy or confidence. So this just illustrates some of the kinds of techniques that might be associated with these theoretical constructs that we have illustrated are associated with behavior. Now, research developing an evidence base for associations or links between behavior change techniques and the psychological determinants of behavior is an important first step in understanding how behavior change interventions work. And this has fed into recent work that has focused on the mechanisms of action of behavior change interventions. Mechanisms of action illustrate how behavior change interventions work. And the linking and the matching of behavior change techniques with constructs from theories is an important first step in this regard. The value of identifying these mechanisms means that we can identify how these interventions work, when they might work, and in which contexts and populations and for which behaviors. It also illustrates or provides us with guidance on which techniques might not work in changing people's psychology, their psychological determinants, and changing behavior. And this will lead to more effective behavior change interventions, but also more efficient behavior change interventions, enabling us to eliminate the kinds of techniques which might work and which might not work, and include the techniques which might work in changing behavior. Now, people studying mechanisms of behavior change assume a basic process model, which theoretically links these behavior change techniques with behavior through change in those mechanisms. And this can be tested through intervention and intervention research and experimental research that provides evidence that including these kinds of techniques from the taxonomies changes these determinants or psychological factors and changes behavior. But there is a need for further evidence because these kinds of mechanisms are not routinely tested in the current evidence. In this diagram, I illustrate that basic process model of a behavior change intervention that I intimated earlier. In the far left, we have a box that represents a behavior change method or technique. And these are the kinds of strategies we have been discussing from those taxonomies of behavior change techniques earlier. And these might be presented, for example, as a persuasive communication or a message, or as a prompt for an individual or a group to engage in a certain exercise or strategy that may result in behavior change. And these techniques are associated, purported to be associated, with these psychological modifiable factors through theory. And those factors are purported to result or be linked to behavior change. And we would need to verify through evidence demonstrating that introducing this technique or strategy through those means of delivery I outlined earlier, for example, would lead to a change in those modifiable factors, and that change in those modifiable factors would coincide with subsequent change in behavior, demonstrating how the intervention is working by changing people's psychological constructs. And this pathway here illustrates the direct effect or the efficacy of the intervention itself. And taken together, the process represents the mechanism of action. And we would need to present evidence supporting this mechanism in order to fully confirm or understand the mechanism by which the intervention is working in order to change behavior. This science of behavior change work, particularly the identification of behavior change techniques, the determinants of behavior change, and the mechanisms involved, provide formative evidence on which behavior change interventions can be based. Specifically, it provides guidance on the selection of appropriate techniques to change behavior in the given population whose behavior needs to change, the behavior that is of interest that needs to change, and the context in which it should be changed. So research on those determinants and mechanisms helps guide the selection of appropriate content of behavior change interventions. One key aspect is the extent to which the population of interest is ready to change, their level of intention or motivation to perform the target behavior, the behavior of interest. And there are some key questions that might help guide the selection of appropriate intervention techniques and the content of those interventions, such as, is the population of interest motivated to change? How strong is that motivation? Is there a habitual component that needs to change? And are there available social resources that can be tapped into in order to facilitate change? Let's take a closer look at these aspects. Quite a few of the theories that have been typically applied to predict and understand health behavior change focus on motivation. This is unsurprising because motivation is a strong correlate of behavior, and those who have low motivation or intentions to perform a behavior are unlikely to do so in the future. So in populations with low motivation to perform the behavior of interest, a behavior change intervention would need to have content, use techniques that target change in motivation. Now, many of the theories that have been applied to behavior change focus on beliefs, particularly beliefs about outcomes, personal resources, and social norms as the key determinants that need to change, and therefore techniques, particularly messages that change beliefs and activate them, would be most effective in initiating motivation and change in behavior. So potential strategies that target change in these determinants of motivation and therefore the determinants of behavior include persuasive communications and threatening messages, modeling, prompting practice, promoting goal setting, and recruiting social support. Let's look at some illustrations. For example, to change people's beliefs or their attitudes, we might present information, a persuasive communication or message within a pamphlet or a leaflet. These physical activity leaflets highlight the benefits or the positive outcomes of performing physical activity on a regular basis. In a similar vein, these kinds of persuasive communications may seek to activate people's risk perceptions, such as this poster, which makes the link between consuming a soft drink and potential risk of a chronic disease. Such communications may also seek to change behavior by activating an emotional response, such as these threatening messages that aim to elevate levels of fear. And that level of fear motivates people to change their behavior in order to reduce the level of fear. These kinds of messages are most appropriate when they're also, or most effective, when they're also accompanied by information about efficacy. How can a person change? Messages can also seek to promote greater confidence and self-efficacy in performing the behavior in future by modeling, such as these persuasive communications and social media messages, which aim to model, using the target population, the desired behavior, that is, women performing physical activity. Although strategies to promote greater motivation or intention is often effective in changing behavior, especially amongst those with low motivation or intentions, sometimes motivation is not enough. This is often illustrated by research demonstrating the link between intentions and behavior, as you can see here. The link between intentions and behavior is often imperfect, and this means that maybe some people are converting their good intentions to perform a behavior, but others are not. And so this association is imperfect. So strategies that might help in this regard would be those that aim to strengthen the intention-behavior relationship. In other words, they aim to fill the intention-behavior gap. Now, dual-phase theories have focused on this intention enactment and focused on planning and certain types of self-efficacy, targeting change in certain types of self-efficacy have been shown to help people enact their intentions and deal with setbacks. And this involves potential strategies and techniques, such as prompting action plans, coping plans, and prompting plans to restart the behavior after lapses or setbacks. Let's take a look. For example, here's an intervention that uses a planning worksheet to prompt individuals to engage in a planning exercise or activity where they map out or plan their activity in future. It prompts them to identify the behavior of interest, when they will perform it, and where they will perform it in the future. These kinds of planning interventions have been shown to be very effective, particularly amongst those who are motivated to change, but haven't exactly thought through the kinds of steps that they need to take in order to do so. But what about behaviors that are highly rewarding and impulsive, such as eating palatable foods, consuming alcohol, or smoking and vaping? These behaviors become bad habits because of the rewarding properties of the behaviors themselves and because they are cued up by cues or triggers in the person's environment. In these cases, motivation again may not be sufficient to get a person to change. The strong habitual component of the behavior often bypasses people's good intentions, and particularly when people have low restraint or control over their behavior, the capacity or ability to resist impulses. In this case, the context or the environment may work against a person's motivation, so even if they desire or are motivated to change, they may not do so because of the cues and the triggers that are omnipresent in their context or environment. In these cases, it would be important to try and interrupt that cue response cycle, the association between the context and the person's behavior. And there are a number of behavior change techniques or strategies that might enable a person to do this, such as restructuring their context or environment, planning to interrupt the behavior when the cue does arise, changing a person's microenvironment and moving them in the right direction through things like choice architecture or so-called nudging. Let's take a look. Take, for example, a person who's trying to eat more healthily. In order to avoid highly rewarding, high sugar and high fat foods, they might adopt a change technique or a strategy of restricting the availability of those foods. So they might not purchase those foods or have them available in their house or at meal times. Here's another strategy to change people's behavior by changing their environment. This is using a choice architecture or nudge, a so-called default nudge. In this case, standing desks were set at the default standing position to promote greater standing at work, which is better for health in terms of posture as well as promoting physical activity. And sure enough, when people's desks were set at default standing position, people were more likely to engage in standing time, more standing time, than when they were set at the default sitting position. So that concludes my whistle-stop tour of the current status of the science of behavior change. I focused on advances that have been made in the science of behavior change, including identifying determinants, modifiable determinants from psychological theory that are reliably associated with behavior, and how we can leverage those determinants using techniques that form the content of behavior change interventions to change behavior and the mechanisms involved in order to come up with optimally effective behavior change interventions. As a coda to this presentation, I will outline some of the things that we need to do in order to advance the science of behavior change. We need more comprehensive data that fills the gaps in that heat map linking psychological constructs and the techniques that are purported to change them. We need more systematic techniques and tests of those mechanisms of action, particularly because that data will provide us with the opportunity to synthesize data on behavior change interventions and their mechanisms. And we need more factorial designs that tests individual or groups of techniques against each other, which may make for more efficient, tighter interventions to change behavior. You can learn more about the science of behavior change in this recently published handbook. The book comprises multiple chapters authored by leading experts from different disciplines on the theory and practice of behavior change. Thank you for listening, and I look forward to the discussion.